Hi, my name is Rachel Kim, and my paper is on increasing knowledge and behavior around HIV for homeless youth in shelters in San Francisco, California. So, according to the San Francisco Youth Report of 2019, there were more than 1,100 young individuals without a safe place to sleep at night and approximately 201 homeless youth in shelters in San Francisco. Nationally, according to state educational agencies, there were 1,355,821 homeless students enrolled in public school districts in the 2016 to 2017 school year. And in a study done by Morton et al. In 2018, they found that youth who are homeless are at a high risk of exposure to a range of physical and mental health problems, violence, early pregnancy, substance use, and early death. However, efforts to solve this problem on a national level are constrained because of lack of credible data and the fact that homeless youth are really hard to track over time. Larkin Street Youth Services is actually a homeless organization that works to combat this issue. And what they do is they recruit formerly homeless youth volunteers to help identify and count their peers, which are other homeless youth. So in a study conducted by Auerswald et al. In 2016, they found that homeless transitional age youth experience a disproportionate risk for morbidity, including but not limited to HIV and other sexually transmitted infections, hepatitis B and C, and psychiatric disorders. In another study done by Reeder et al. In 2019, they found that youth and young adults living with HIV are less likely than older adults to be aware of their HIV serostatus and to adhere to antiretroviral therapy. And this is even more true for the homeless youth because um, they have less or no access to treatment or testing. And in the same study, there was an online survey for youth with HIV, and they found that 50.6% of participants reported living somewhere other than their own place or their parents' place, and 52.5% reported experiencing homelessness or living in a shelter. This indicates that there's either an association between homelessness and HIV or similarities in risk factors between getting HIV or becoming homeless. For commercially sexually exploited children, using HIV preventative methods may actually be seen as the opposite of a benefit because they need access to resources as soon as possible. However, it can be taught that in the long run, following HIV preventative measures can be beneficial for their long-term health and well-being. On top of that, preventing HIV will also help to prevent other infections and diseases, which they may be more susceptible to without safe shelter, proper hygiene, or clean food and water. And this is part one of my marketing materials. It's a church bulletin board script. And it says, are you homeless? Are you a homeless youth under 25 years old looking to connect with a shelter? If so, this free HIV education program can take place right where you sleep. Individuals will be given $20 to participate and must be connected to a shelter for homeless youth, such as the Huckleberry House or the shelters hosted by Larkin Street Services. Free HIV self-test kits, condoms, and education on various topics will be provided. Connect with the shelters mentioned and let a staff member know if you want to participate in the program. And then I gave the two addresses for the shelters listed. And this is part two of my marketing materials, and it's an Instagram post. So for both of these materials, I wanted to make sure to let it be known that there's $20 for participation because I figured that it would attract more participants for the program. And this is just the timeline for the whole intervention. It starts with planning strategies with the help planning marketing strategies with the help of homeless youth organizations and recruiting volunteers, creating the marketing materials, reporting the amount of participation queries, pre-assess individuals, create HIV program, start first wave of self-testing, and provide condoms and information on more free condoms, educate homeless youth on HIV preventative behaviors, and provide follow-up information for HIV seropositive individuals. Educate homeless youth on how to alleviate family conflicts, apply preventative behaviors through role play during skits, second wave of self-testing, and then end the HIV program. Then there's the final wave of self-testing, organize HIV serostatus data from test results, and then $20 incentive, which I figured that it'd be better to give it near the end because if we gave it in the beginning, there's a greater chance that people would drop out after getting the $20. And then finally, evaluate HIV incidence and prevention in the homeless youth community. So, nationally, according to Reproductive and Sexual Health, an estimated 19 million new cases of STDs are diagnosed each year. People between the age of 15 and 24 account for almost half of these cases. And why does this matter with the homeless youth? Well, transitional age youth account for a large proportion of STD cases each year, and homeless transitional age youth are more vulnerable because of their disproportionate risk for morbidity. They're also at a greater risk for other infections and diseases compared to the general youth population. And overall, homeless youth are at a greater risk for contracting HIV and will be more severely impacted if they do become HIV positive. Efforts to prevent HIV in this vulnerable population will also be preventive of other infections and diseases, improving their overall quality of life. So, in the practice based intervention, one of the lessons focused on educating homeless youth on how to alleviate family conflict. This is a more upstream solution to preventing HIV in this group because a proportion of them are runaways, and reuniting them with their families would lower their risk for HIV and other negative health outcomes that come with living on the streets. In a hypothetical future version, it would be beneficial to have a longer program so that the lessons could focus more on this upstream solution. And other programs actually attempt to normalize family conflicts as well, which may be a fitting component to add if there ever is a future version of this program. These are my references. Thank you.